It's Wes, SuperWes that is. In this video I want to talk about the Bivona tracheostomy tube with the foam cuff. First of all, you notice up here it's spelled F-O-M-E. That is the way it's spelled. Although it is foam. The foam cuff is a self-inflating cuff. You do not add air at any time. It is the original long-term trach cuff because it self-inflates. You don't have to add any air to it or water, and that the foam inside the cuff will expand and leave very little pressure on their trachea. The pilot tube and the pilot balloon on this cuff will be red, and it doesn't have a little valve to inflate. It just has a little stopper. This should always be left out. The only reason you're going to use this is to deflate the cuff, usually upon inserting or removing the trach tube. Also, once daily, the cuff should be deflated all the way and pull with some pressure with the syringe in case any condensation or phlegm manages to get inside that cuff. One important piece to this trach tube that always gets thrown away is the side port connector, or the side port auto control valve. Since this trach self-inflates, when the patient has a ventilator attached to their trach tube, it's common for the air to leak around the trach. So to hook this up with a ventilator, the side port auto control valve is attached to the trach tube, and then the ventilator is attached to the side port auto control valve. But then the pilot balloon is attached to the connector on the side. That way, when it gives a breath and when it's most apt to leak, it will also apply a little bit of air to the trach cuff also, and keep it from leaking around the cuff, but it will only do that during breaths. Be sure that this side port connector is on the superior side of the trach tube. If it's on the inferior side, water, phlegm, condensation will get in here and it'll make a mess of this tube and the cuff. If you have any other questions about the Bivonas specifically, or these little devices, the obturator, the Bivona disconnect wedge, please check out a couple of my other videos. If you like what you see, please hit like, comment, and subscribe to my video channel. Okay, thank you so much.